we don't often get to think about the strategic implications of what we do or how our work can be leveraged to support strategy or even to write strategy, to think about that. That is not something a lot of medics get a chance to do. Coming up through the IHS program, you have to think about that. You won't be effective if you're building missions, you work at a component like I worked at Air Force at Southern. If you build missions that don't meet the strategic objectives, the intermediate military objectives of the component command or the strategic vision of the combatant commander, you will be useless. So you have to understand that, and that shapes then the things that you do. So getting to work at that strategic level and sort of work in that joint operational planning, I think is a very unique opportunity that IHS offers. And that makes you a better officer and makes you a better enlisted personnel. And it's a unique opportunity.
It took me from being a leader of only a couple of people and managing programs to really being able to coordinate and organize and being able to lead people. A lot of times it was me organizing an event and I know what the AFCENT commander's intent and vision is, or I know what the CENTCOM commander's intent and vision is. Airmen coming out of Bowling Air Force Base doesn't necessarily know those commanders' intents and visions. So it was my role to be able to communicate that to our teams that are going out there, that are building these relationships, that are teaching these skills. That piece is what you'll constantly take with you. AFCENT was probably the best assignment that I've ever had. There's so many aspects of it that you do take with you in your career. It's really hard to put your finger on exactly what it is, but I see it in my squadron, and I see it when they ask me things like, hey, how do you plan an exercise? Or how do you get into this program because I have a language skill? How do I go teach AE to another country? And I've already been afforded those opportunities, so you can do that kind of mentoring and bringing people along, creating the next generation of the Air Force that's not just looking at the patient in front of you, but is looking at our partner nations and their capabilities and how we can interoperate with them.
One of the things that you really get out of IHS is some of that health diplomacy skill set, working with people from different culture, different background. You certainly want to do whatever we can to advance U.S. interests, just trying to be attentive and be welcoming and building some of that networking. Those are skills that kind of are readily transferable to whatever you may be doing.
In IHS, or as a full-time IHSer, is super collaborative in nature, so you're expected to interact with a diverse national and international workforce and partners. Things like language, cross-cultural and geopolitical skills can go a long way whenever you're in this environment. The foundational training and the different opportunities you get to hone those skills, super important. So the skills that you practice while IHS, those have definitely been instrumental in my continued success.
I think as I go into, even as a squadron commander, and we're working COVID ops right now, as I go into our planning and bigger picture, I'm getting outside of the nurse. One of the things I always said when they would come back after, once I became an IHSer, and I would talk to folks, I would say all that PME that I had to do, my ACSC, where they talked about theater campaign objectives, national security strategy, I did not understand connected as the nurse on the floor in the MTF, in the outpatient clinic, until I became an IHSer. When I became an IHSer, it all came together. This is the first time that I really can see how my actions, and even my actions of those fellow nurses out there on the floor or wherever, how we really contribute to our national security strategy.